Welcome to the Complex Chronic Diseases Program orientation video. This video is to provide an overview of our program so that you know what to expect. Here are some of the scenarios we hear patients have experienced with their visit to their doctors prior to coming to the program.
What you're describing to me sounds like you're working too hard and you're overstressed. I think the fatigue is because of the overwork.
No, I don't think so.
You've stumped me. I think if you see a great psychiatrist friend of mine, we'll be able to sort this out. I think you might just be depressed.
I don't think that's it.
At the end of the day, I think it might all be in your head. If you get a gym membership, that'll help you get out of the house, and you'll be doing something and it'll make you feel a lot better.
I think it's a little more complicated than that.
I think there might be a good alternative for you. I'm going to refer you to a program at the BC Women's Hospital called Complex Chronic Diseases Program.
Sounds great. Thank you for listening.
Hello, welcome to the Complex Chronic Diseases Program. My name's Darcy, and I'm one of the nurses in the program. In a moment, I'm going to introduce you to a couple of actors who are going to play the role of patients on the initial stages through the program. Those actors are also going to play the roles of doctors and nurses throughout the video.
Darcy, are we ready to go?
We really want to be accurate in describing what a patient goes through.
What do we need to know about this patient population so we can make it as real as possible?
Well, no two patients are exactly alike, and many patients have been misunderstood by their physicians and even their family and friends. With these chronic illnesses, they don't always look sick on the outside.
So they're tired of explaining an illness that's not visible to an untrained eye?
For sure. And they're tired of explaining that it's more than just being tired. It's like energy exhaustion down to each body cell. And there are many more symptoms that affect our patients.
So they're ready for learning some strategies that actually help?
Patients want answers, and there's still a lot that we don't know about these chronic illnesses. They've tried everything, and they're wondering what we do differently.
Okay, so what kind of diseases are we talking about exactly?
So we see patients who are over 19 years old who have a diagnosis of myalgic encephalomyelitis, fibromyalgia, or alternatively diagnosed chronic Lyme syndrome, or symptoms of fatigue, pain, cognitive difficulties, non-restorative sleep, or post-exertional intolerance.
Okay, let me try. Fibromyalgia and myalgic encephalomyelitis.
That's close. There's still a lot of different views on what we call the illnesses. So some patients and even their providers might use the word chronic fatigue syndrome instead of myalgic encephalomyelitis. What's important to us is that we acknowledge the symptoms of the illness and do our best to see how we can help.
So how can someone become a patient at the CCDP?
Well, since you already have your referral from your family doctor, the next step would be the welcome session. It might actually just be easier for us to pull up the patient journey map on the screen so patients can follow along at home.
Yeah, that's good. Let's do that, and then we'll see the welcome session.
Great. Welcome to the Complex Chronic Diseases Program, or CCDP for short.
Why are there so few people here at this welcome session today?
Well, because we're a province-wide program, we decided to make this welcome session into a video that patients could watch at home.
Now, as a man, I'm feeling a little bit uncomfortable. Should I actually be here at BC Women's Hospital?
Yes, you are in the right place. This program is for both men and women. We work together with our patients to really deliver a comprehensive healthcare program that includes clinical care, education for you and your family members and your healthcare providers, as well as we have a very innovative research program. While you're here in the program, we'll work together to come up with a treatment plan that includes your family doctor or primary care provider as well. We really want to focus on holistic care as well as evidence-based care. So what that looks like is we integrate all of the different areas of healthcare, including physical, emotional, mental, and spiritual health. We really know that that includes a very comprehensive medical assessment, as well as any investigations or diagnoses that you might need. And we do that all together and move forward with a plan that you feel good about.
Are there some written materials I can take home with me after the session?
Yes. We will contact you to make your first appointment, and at that time, we'll send you a CCDP patient binder.
Wonderful.
Great, thanks.
Thank you.
So the CCDP binder is something that you'll bring with you to all your appointments. It kind of grows with you as you go. It's something to start you off, and it has a whole bunch of resources in here. So like your journey map and like the details about the
Okay, whoa. Let me cut in. That is a lot of info. Why don't we put a slide on the screen with all of that information so that someone at home can pause if they need to?
Good idea. You can really make this binder yours. So you can add in articles that you find interesting, handouts from the team, keep track of your appointments, and really keeping track of the good work that you're doing while you're in the program.
Okay, so bring this with me to all of my appointments, and don't be intimidated by the binder because I'll be filling it out over the course of the year.
Yes, or however long that you're in the program.
So what kind of notes should I be making?
Well, notes about the history of your illness, including, some of your symptoms or diagnosis, your medications, supplements. Well, actually, you don't even need to write that down because we have a team visit prep guide that's right in your binder. So you can fill that out just in time for your team visit.
Okay.
At the CCDP, we start your care off with a complete assessment that guides your treatment plan during your time in the program. This begins with an intake call. At the intake call, we really want to get to know you a bit and hear about how your illness is and has been, like when you got sick and how it's been going and how you're doing now.
Okay, so Darcy, I'm not sure if I understand what you mean exactly. Is it just me talking about my journey on the phone?
Well, that's a good way to think of it, Catherine. Let's watch and listen to an intake call, and we can show you an example of some of the things that we hear from our patients.
Okay, let's cut to the scene. Hello?
Am I speaking with Catherine?
Yes.
Hi, Catherine. My name is John, and I'm one of the nurses from the CCDP, and I'm calling to do the intake call with you today. Catherine, can you please confirm with me your birthday so I know I have the right Catherine?
Yes, my name is Catherine Moore, and my birthday is June 21st, 1983.
Okay, let's get started. Do you have any questions first off?
Well, I am starting to feel a little bit overwhelmed about starting the program. I'm worried that I won't be able to keep up with all the appointments and the suggestions from the team.
Our role is to help to support you as you come through the program. We offer ways to help you access the services while respecting your health goals and your energy levels as they fluctuate.
Okay, so I can set the pace?
We recommend that you tell us when things are going too fast. We can offer phone appointments for most of the professionals on the team, and we recommend that you space your appointments out to give yourself the time you need.
Oh, thanks. That's really great to hear.
Can you tell me about your illness? When did you become sick?
Okay, well, I was running at full stride, but I've since completely ground to a halt. It's like I can't even walk around the block anymore. And I think my husband feels like he's married to a completely different person now.
That sounds like some big changes. Can you tell me more about that?
Okay, well, it's like I don't even recognize my life anymore. I can't do the things I used to do because of this really crippling exhaustion. I was an avid hiker. I took care of my family and my 2 dogs. I had a garden and a really active social life. It's like I can't even do the things that make my life mine. And to make matters worse, it's like my friends and my family don't even recognize how sick I am because I'm not in a wheelchair, even though most of the time I feel like being in one. And my family doctor doesn't even know anything about this illness.
Thanks for sharing those details, Catherine. It helps us to know a bit more about you and acknowledge what you have gone through. Let's come back to this after more visits with the team, and then we can help create some more ways forward. So the goal for the next month is to do a thorough medical assessment and figure out how we can work together to help you get some answers and improve your health. And what questions do you have?
Well, I've heard about research for the program. What's involved with that?
The team is very committed to research and asking important questions to find out more about these illnesses. We'll have different studies going on, and if you're interested and you meet the criteria, then you can participate. There's a consent form that you can sign ahead of time so that we contact you when research studies come up. Our Research Advisory Committee meets regularly to help move our research questions forward. Any updates we have will be posted on the website.
Okay, great, thank you.
We didn't want to go through an entire intake call with you, but just really give you a sense of one. We really hope that our care and compassion comes through, and we acknowledge that even though we may not have all of the answers, it's very meaningful for us to hear your story and learn more about these complex chronic diseases.
So what happens after the intake call?
The CCDP team visit.
Who is all on the team exactly?
Well, during the team visit, you'll meet the nurse, the social worker, and the occupational therapist, but we have a lot more people on the team. We have like specialized doctors, we have naturopathic doctor, we have counselor, we have...
Let's just maybe see that up on the screen.
True,
And then
yes.
you can read them, okay?
Okay. So, we have physicians, including internal medicine physicians. We have general practitioners. We have GPs doing acupuncture. We have specialists in infectious diseases, nurse practitioners, nurses, a counselor, a registered dietitian, physiotherapist, occupational therapists, social workers, and a naturopathic physician. So as I was saying about the team visit, that visit is a 90-minute visit where you'll have a half an hour with the nurse, the social worker, and the occupational therapist to assess your health care. We all really want to be on the same page when it comes to giving you the best care possible. So we know it's a bit of a lengthy visit, but you can just tell us how to make you most comfortable.
What happens after the team visit?
That's the CCDP physician assessment. So that visit is also 90 minutes, and it's with one of our internal medicine specialists. So it's a chance to do a complete medical assessment, including whether or not people need extra investigations to make or confirm a diagnosis, and to start talking about the treatment plan.
All right, let's take a look at that scene.
Hello, I'm Dr. Bailey. I will be with you for the next 90 minutes as we complete your medical assessment. So the purpose of this visit is to discuss your history of illness, including a physical exam, and then to start to develop a treatment plan based on your assessment and your goals going forward.
Great. Everyone's been really nice so far.
Good to hear. And then based on your history and exam, we will then determine what further investigations may be needed, and then either I will confirm or make a diagnosis. We'll also make sure that your family doctor is involved in your treatment plan. Do you have any questions before we start?
Which team members will I meet with?
Well, depending on your needs and goals, you will either meet with all of our team members or just a few. Every patient's needs are different. And treatment plans may include new medications, significant changes to the way you manage your health, interventions, or other treatment modalities that we have access to.
Well, this is just what I've been looking for. Now, I've heard that I might meet with a naturopathic physician or even an acupuncturist.
Well, it is a bit different than other treatment programs. These are complex diseases that require complex treatment. We believe in comprehensive medicine based on strong scientific evidence so that we're making safe recommendations.
This is different. Thank you. What an interesting start. So, Darcy, what's next on the patient's journey?
Hey, I think we should show every visit to the clinic over the year with all the different practitioners.
Wow, yeah, that might help some patients prepare, but each patient is very unique and their journey may look a little different, so that might be hard to capture. Our goal is that we really provide specialized healthcare for these patients and acknowledge the complexity of their illness.
Okay, but what happens when someone gets to the end of their journey? Can you explain a bit more about how the patient's primary care provider is involved?
Yeah, that would be good. We haven't talked too much about the patient's primary care provider.
Right, yes. The patient's primary care provider or family doctor will continue to see their patient all the way through as their patient sees the professionals here in the program. We'll send the family doctor the consult notes from the visit so that they can keep up to date, and they can call our team for advice at any time and even after their patient transitions from the program.
Wait, does transition mean I don't come back to the CCDP for follow-up appointments?
Well, Jamie, our program is a consultative model, which means that patients come here and use the benefits of the program while they're here and complete their care plan. After they leave, their doctor can assess their needs and see if maybe a call needs to be made to one of our clinicians for some advice, or they can actually just re-refer to the program.
That makes sense. There must be a lot of patients waiting to come to the CCDP.
Thank you both so much for coming in to demonstrate what a patient's journey looks like in the initial stages of the Complex Chronic Diseases program.
And we're glad to help.
At CCDP, we empower you to work with us when it comes to your healthcare. We work closely to ensure that you've had a comprehensive assessment, including a diagnosis if you need one, and a treatment plan that you feel good about. The team is here for you, and communication is really important to us. So we want to make sure we involve your primary care provider or physician the whole way through to help you succeed long term. Welcome to the Complex Chronic Diseases program. We look forward to working with you.